Good afternoon, everybody. My name is Scott McGann, Falmouth Health Agent for the Falmouth Health Department. Today's November 19th, 2021, doing our weekly COVID-19 update. Our email is health@falmouthma.gov. Our phone number is 508-495-7485. And our website with a COVID tab is falmouthma.gov. So this week, we're up on cases. 2141 is our total case count as of yesterday. I take these on Thursdays. 37 cases this week, and actually today there's been a pretty good number of cases, so I'm seeing an upward trend on cases. 3 probable cases for the week. Our positivity rate didn't change much, 9.6. That's daily cases per 100,000, which equates to about a little more than 3 cases per day. Our 14% positivity stayed pretty much the same. That's 10/31 to 11/15 data. Weekly case trends show the last couple of weeks up. I tell you from what I've seen going, and plus next week, keep in mind, it's getting dark early. People are more indoors, more indoor activities. The holidays are coming up. I'm seeing at least the last couple days a bit of an increase. I wouldn't be surprised if next week we're higher. Hope I'm wrong, but when I show you the county data, you'll see that as well. So you can see that the case counts have ticked up only for 2 weeks, but we are getting into the holidays, and we'll talk about what we saw last year as well. Like, look at here. You're into November of 2020, it starts to tick up, not too dissimilar from before, and then we had a lot of case counts. Now we do have vaccinations, we have a pill coming, I'll talk a little bit about them. It's not last year where we had none of that to help us. But case counts, I think, are going to take a similar rise, maybe not to the same extent. I hope not to the same extent, but I think, the holidays, you're going to go visit, people are going to do that. I'm not telling you that you shouldn't do that. I'm just saying that there is going, my gut tells me that we're looking at an upward trend. And when I talk about the state, you'll see that as well. We'll skip over this. So look at the county. Look at this far right. You can see 245 for 3 days. So they're seeing an increase. That sort of meandering up and down, that this might be more of our summer and fall when people are still outdoors, sort of baseline. I don't know what our baseline is going to be for the winter. You can see what it was, as soon as the holidays kicked in last year in 2020, you see that peak. We may see something similar, hopefully not as high. Only time will tell on that. But I can feel us on an upward trend, even countywide. Again, countywide, you can see it. 3 days doesn't make a trend, and neither does going back up to here inherently make a trend. It's just the gut feeling with mine, knowing what's going on, that I think we're going to start seeing a bit of an increase in cases. Hospitalizations, we had 3 consecutive, the 1st, the 4th, and the 14th with 0. You see 5 and 1. It doesn't, obviously will correlate. The more cases, the more likelihood to have hospitalizations. It's also where and who. Unvaccinated people are far more likely to end up in the hospital. And it also depends on, again, who it hits and their immune systems and so forth. I'd say we weren't going to continue to remain 0. We'll see if the 5 starts to continue to increase. You can see the same increase at Cape Cod Hospital. They were below 10, below 10, below 10, then 13, then 18. So, again, we have another slide that we talk about that as well. State, the last few updates that I gave you were about 1,500, 1,700, 1,300, now 3,000. So that and the positivity is both up. We were below 2, we're already at 3. So you were seeing that sort of way. Now the deaths are not. There's a delay to this particular spike, obviously, with that. But hospitalizations, I'll go to the charts next to show you the trends. You can see that hospitalizations got a little bit of an uptick. I would wait to see if I think that's an issue. Positivity, you can definitely see a little bit of an upswing in here that we've gone from, around 2-ish up. You don't see it in deaths at this point. You do see that uptick at the end, sort of in that higher range. I think we're going a bit higher in the state. I think everybody during the winter, we're definitely going to go higher. To what extent, I just don't know. In terms of incidence rate, this is the number of cases Falmouth averages. All towns average, if it had a population of 100,000. This allows Truro and Boston to be compared, infection rates, when one population is 3,000 and the other's hundreds of thousands. We're definitely doing better. A lot of towns right now are in the much higher incidence rate, into the 20s and 30s. We're at 9. But we are, I think, at least early on for this next week, we'll be trending on the higher side, just from what I can see in the cases today. Our percent positivity, again, is definitely on the lower end from these other towns. Wellfleet's as high as almost 8, Harwich is 7, the state's 2.26. So we're below the state for this particular data set, which is from the 31st to the 13th. You can see that we're below, we want to be below the average. So we are definitely that, at least for that data set. And hopefully we can stay, from mid-range to the lower end. COVID cases in fully vaccinated individuals still, again, if you've been vaccinated, it's still 1.3% of the population that's been fully vaccinated has gotten COVID through breakthrough. 0.04% of hospitalizations among that population, and 0.01 of deaths. 509 into 64,000 is probably somewhere around between 3.5% and 4%. Hospitalizations of 2,000 into that is somewhere around there. So, I mean, the vaccines work. They definitely work. We'll talk about boosters in a second. But, if you've been on the fence about vaccinations, you'd really want to consider it, considering that, we're getting into a season that tends to have a higher case count. Vaccination rates, we have definitely gone up in vaccines over the last week. Fully eligible, fully vaxxed around the county, 12 plus is 83%, 75 of the entire population is fully vaxxed. You look at Falmouth, we've done 688 doses, 484 first doses, 204 second doses. Biggest gain among 5 to 11s, because of course they were just recently authorized. Falmouth Public Schools did some this week, so not all this data goes as the 16th, so not all those clinics would pop into this, so you'll see another increase next week. So, that's, last week it was a 10% increase, this week's an 8% of the population, so that's a good increase. I don't think we'll necessarily hit in the 90s in that age group at all. You can see where it drops off as you get into the younger ages. There's plenty of pediatricians done probably several hundred each of the major pediatricians' office, plus Falmouth Public Schools offered it. A couple hundred there, 200 to 300, I think. So, we'll get there to where we get to our point relatively quickly. It's not an issue of access like it was earlier this year. There's plenty available. I filled out a form and got 300 really quick. I wish that was the case back in April. We could have done that for everyone. So you can see that we're doing well. We have increases. That's a very good increase. So 27,000 of our 31,190 population had at least one dose, which is 87%, and definitely entire population, and almost 23,594 fully vaxxed. These numbers, obviously, the bottom, the 90% of eligible and 79% of fully vaccinated dropped when we added the 5 to 11, but that's starting to build back up because, again, we're starting to vaccinate that age group. Vaccine availability, VaxFinder, mass.gov, pharmacies have them. I have not heard of any backlog. Barnstable County Health Office still does a clinic. You can check their website. Convenient MD did have some. Community health centers also. And homebound. Homebound, please call the health department. So I've heard some calls to the senior center. They'll refer them to us because that's how we did it previously. We used the senior center. If you do that, they'll just refer it to us. We'll get somebody from the VNA. We got a list this week from that people had called the senior center. Call the health department. It saves just an extra step. So if you have somebody who's homebound, call us and we'll get the VNA out there to go to the house. So we still have vaccines plenty readily available. Testing is readily available. Same places as usual. Test and stay at the schools has been a bear over the last week or so. They're doing it and they're running with it. So school-based test and stay. You still have Convenient MD, CVS, Falmouth Hospital, the fairgrounds, and the community health center does your main testing. Booster doses. So the governor changed this today. So the vaccine, you either go to vaxfinder.mass.gov, or you can also call 211 if you don't have a computer. But anyone over the age of 18 who's received at least Pfizer or Moderna at least 6 months ago, or J&J at least 2 months ago, can get a booster. So they cut out the red tape that said anybody 18 or older, you can get a booster. And you are allowed to mix vaccines. So if it's been 6 months, you can get any vaccine you want. Again, go to vaxfinder.mass.gov if you want a booster dose. Again, Pfizer is a 1/3 dose. Pediatricians have them and have scheduled them and given them, and our clinics have been this week. And I'm sure we'll do them later on. We'll continue to do them as needed. Again, I put the slide up again. The good news is, yes, the cases are rising, but our vaccinations are good. We know that the vaccines work. It's not about necessarily getting a mild case of COVID. It's about getting a serious case of COVID. And these are two more tools in the toolbox. Paxlovid and molnupiravir are two that are down the pipeline. So if you could take a pill, if you get tested positive and you've got some symptoms, you could be prescribed this as an oral treatment at home. It supposedly does really, really well, especially if you've already been vaccinated. I think that double protection there is really big. And really important, because I don't think COVID necessarily goes to zero at any soon point in time. It's just going to meander and be what it is. Like we saw in the summer and fall, that 20s to 40s, maybe our winters is some number higher than that. And, I don't think it just necessarily goes away anytime soon. So it's more about the management of it. And so that's another tool in the tool chest. Face coverings, nothing has changed at this point in time. Obviously, we continue to monitor, watch the cases. The Board of Health and I will continue to talk about this at every meeting. That's where we are with that. Now, this chart, if you look at this chart, I've been giving this every week. Our daily incidence rate has not changed. However, thank you to Scott Kay, who pointed out that it seems like the CDC chart that we've been using, I've been using the daily incidence rate and putting that in the low model of substantial. They're saying take that and multiply by each day of the week, so multiply by 7. Even though our incidence rate hasn't changed, the moderate substantial is going to be based on multiplying that number by 7, so that was an error in mine. And once I did it in August, I continued it every week, so it's not like I go reread it every week. I did the calc that way, and it sort of ran with it. And so I've duplicated that error for a while now. The difference between moderate and substantial is only going to be about 21 cases, 20 to 21 cases per week, which is a very, very tight bar in my opinion. That's probably why when I read it, didn't do it that way, only because, that would be equate to 2 to 3. Once you hit 3 cases a day, you'd be over into substantial. Reason being is 3 cases per day of an actual incident rate, and then you calculate it up to the per 100,000 means 9. So when you get a daily incidence rate per 100,000 of 9, for our populations, it's about 3 cases per day. And 3 cases per day, 9.6, you can see there. So that's, 3 cases, 21. So our average was 20, in the 20s for that particular data set. This is going to put you into substantial. So you really would have to be well into the 2s to less than a case or 2 a day to be into the moderate, and less than a case a day probably to be into the low. So I've recalculated it, and I'll present it correctly from now on. Apologize for that. I'm human, make mistakes, got a lot of moving parts. COVID's not the only thing we do at the health department, but I do apologize for it. Our positivity hasn't changed, it's still low. And the other things that the metrics for transmission, we looked at hospitalizations. It's up a bit, but 5 and 1 is very common to what we've had throughout the pandemic. I'll keep an eye on that as well. Our vaccinations have definitely gone up. We're always going to nail it on that. And we've typically nailed it on hospitalizations, unless I hear anything else from the hospital. So 3 out of 4, and we've been bouncing between moderate and substantial, looking at those case counts that we've had. Again, looking at somewhere south of 25 being the line in the sand. So as a recap, Falmouth, case counts are rising. They're rising locally. Again, that was that one spike, the number that you saw in the county chart. Don't know if that's a thing to come. Today we had quite a few. We're a bit higher over the last couple of weeks. Don't necessarily know if that's going to mount to it, but knowing that they were going into the holidays and going to Thanksgiving and people are going to travel, there's going to be a good probability that the cases, could go up to some point. I don't know, and I don't know by how much. And the state's definitely shown a sharp increase over the last week. So we'll have to keep an eye on it and go from there. Now, as far as vaccine eligibility, again, everyone at 5 and over. The governor just changed the 3rd dose boosters for all 3 vaccines to 18 plus. So you didn't have to have certain comorbidities anymore or a certain job function if you want it. It's been 6 months and you're over the age of 18, you can go down and get a booster if you like. And 5 to 11 doses clinics, we're doing it at Falmouth Public Schools this week. And we can continue to do them as needed. It's not, it's much easier to get vaccine this day and age than it was earlier in the pandemic. And so, that's one tool. The pill coming down, the 2 different treatments, that's going to be, hopefully a game changer as well. But so for my recap is just know that we are going into the winter season. The holidays are here. People are going to travel. There are going to be more get-togethers. There's going to be more, chances for transmission. And it is what it is, so we need to keep an eye on it. And as far as mitigating things and going into, making other decisions locally, this will be talked about with the Board of Health. And we'll reevaluate it and continue to watch and, go from there. So that's my recap for the week. And next week, I think with the hall, it's a day off here at Falmouth at Town Hall, I think FCTV as well. So we're going to skip next week. What I'll do is I'll take the data that I put on, if you've looked at the website, I'll scroll back up. So I put this chart up, and I put our positivity up and our incidence rate up on the chart on it every week, and I list the case counts. I can do that again next week, even though we skip the presentation, but you'll know the gist of it as far as case counts and that so forth. So, we'll skip this week, so that'll leave us into early December for our next update. So, thanks everyone. See you next week.